15 weird signs that show that you're having liver damage. Hi everyone, it's Dr. Derek here. Over the last decade, the number of people dying with an underlying cause of liver disease in England rose by 40%, and this number is climbing. The reason why I truly think that this video is so important for you and all the patients that come to my clinic is because we know that most liver disease is preventable, with over 90% of severe cases being due to three main risk factors: alcohol, obesity, and viral hepatitis. So, knowing some of the signs of damage will push you in the right place to act fast. This is where you really want to be. Starting off at number 15 are these white deposits you see around the eyelids. The doctor will refer to these as xanthelasma. These white deposits form when cholesterol builds up underneath the skin. The liver plays an important function in lipid metabolism, and when it gets damaged, it can't perform this adequately. This is what leads to these fatty deposits around the eyelids. Next up, at number 14, is the presence of pale stools. You see, any dysfunction of the liver will affect its ability to produce bile. This is a colored and pigmented compound. A healthy liver produces bile by secreting bilirubin, bile acids, cholesterol, proteins, and water into tiny ducts that feed directly into the gallbladder. Less bile circulated means that the stool will lose its pigment, becoming paler in color as a result. Bile is also responsible for breaking down fats. Less of it around, which we see in liver disease, could lead to our next symptom to be aware of in number 13. This is the presence of floating stools. Stools float because fat ends up not being broken down due to the lack of bile acid being around to do the job. You therefore end up passing more fatty stool, which is more likely to float on the surface. Next up in number 12 is yellowing of the skin. We often refer to this as jaundice. This can be seen in liver disease, in the yellowing of the skin, and also sometimes yellowing of the white of your eye. This is caused by a colored compound known as bilirubin, which we've just talked about. Jaundice occurs when the liver struggles to process bilirubin, leading it to accumulate in the bloodstream and causing yellowing of the skin and the white of the eyes. Now, one of the main functions of the liver is to produce our clotting factors and also our platelets. These are essential in the system that stops you from bleeding easily. A decreased production of these factors as well as platelets by the liver when it's damaged means that this essential role in keeping the balance becomes affected. This leads to easy bruising. An example of this in number 11 on our list is the presence of bleeding gums. Up next, and in number 10, is a symptom we call finger clubbing. Take a look at the picture here. In finger clubbing, the nail curves down so that it eventually looks like an upside down spoon. Studies have shown that this finger sign of clubbing is present in 24% of patients with primary biliary cirrhosis. This is a subtype of liver disease. It's also present in 29% of patients with active hepatitis. Number 9, and staying with our fingers, is a condition known as Terry's nails. These are white nails and white nail beds, which are sort of looked washed out. Now, the exact cause and reason for this in liver disease is yet to be fully determined, but it is thought to be due to a change in nail bed blood vessel supply, secondary to the overgrowth of connective tissues. Number 8 in our list is a condition known as spider angiomas. These are basically these spider-like blood vessels that can appear on the skin. Now, the body's ability to metabolize sex hormones such as estrogen is affected in severe liver damage, and this increase in circulating estrogen levels has been shown to be linked to these spider angiomas. In number 7 is gynecomastia, or excess breast tissue development in men. This is also caused by the presence of an increased amount of estrogen circulating in the body. We see this in severe liver disease. At number 6 is a pain in the right side of the stomach. This is where the liver is located, and if damaged and inflamed, the liver will press on surrounding nerves such as the phrenic nerve, leading to the pain sensation. Now, staying with the theme of organ inflammation, and up next in number 5 is an enlarged spleen, also known as splenomegaly. When the liver gets damaged, its function drops. We also get this increased pressure in all the surrounding vessels of the liver. This increased pressure is what causes the surrounding organs, such as the spleen, to increase in size. And in number 4, this is the development of esophageal varices. Varices are a serious complication of liver disease, and is basically the presence of these enlarged veins in the esophagus. The esophagus is a tube that connects the throat to the stomach. Esophageal varices develop in severe liver damage because the regular blood flow to the liver becomes blocked. The blood then becomes diverted through these smaller vessels that aren't really equipped to carry these larger volumes of blood, and because of this, the blood vessels can burst and pop, leading to this life-threatening internal bleeding. Number 3 is an intense itch, which can occur on the palms of the hands or the soles of the feet. This is caused by the buildup and inadequate metabolism of salts and bile acids, which can then accumulate under the skin and cause this really intense itch. Number 2 on our list is the presence of ascites. This is when excess fluids collects in the spaces within your abdomen. Now, this happens because when your liver doesn't work like it should, the pressure builds up in the main vein that supplies the liver. Now, this extra pressure blocks blood flow to the liver and also affects the kidneys, meaning that fluid builds up in your body. Over time, this fluid leaks out of your veins and collects in your belly. And last on our list, and at number 1, is a condition known as hepatorenal syndrome. This is an acute kidney injury that's caused by chronic liver disease. Specifically, significant liver disease can lead to the severe narrowing in the blood vessels that supply the kidneys. This can then result in reduced blood flow. Hepatorenal syndrome is a life-threatening condition with a poor prognosis. So the good news here is that although you are now aware of all of these signs, there's so much you can do to control your risk factors. This comes from, monitoring your diet to a healthy, balanced diet, reducing your sugar intake and also your alcohol intake to the recommended guidance levels. Now we talked about these signs of liver disease, I hope you can now understand that an issue affecting one part of the body can also affect another. We talked about one other body organ here in the kidney, which can also be affected by liver dysfunction. Make sure that you check out this video here in order to understand more about how to protect this other vital body organ. As always, please leave a like and subscribe if you found today's video helpful. And remember, I truly care about your health, and I wish you the very best.